1.5 billion years ago, which gives you an idea of how ancient this glucose vitamin C transition is in biochemistry of life on Earth. So the medical view is that if you don't have enough vitamin C, you're going to get scurvy, all right, which is true. But it takes a long time to develop. There's a doctor called Crandon, who he was newly qualified doctor in 1940, and he did an experiment on himself where he developed a diet which had no vitamin C in it. So he denied his body vitamin C. And he basically gave himself scurvy and documented what happened. And it took 90 days of having no vitamin C in his blood before you started to get, obvious signs of scurvy. Now, you can argue that that kind of proves that we don't need vitamin C, which is true if you're concerned about really gross, gross problems with your body, right? We all don't get a lot of vitamin C in our diet, and we function. But this is just the details of his experiment, but it's not. We don't need to go into the details. So the physiology. One of the most important things about vitamin C is that it's required for collagen production, right? So collagen is present in skin, bones, ligaments, and all the blood vessels. So if you don't have enough vitamin C, you can expect to have problems in these parts of your body. It's also used in neurotransmitters, steroid hormones, bile acids, and it's required to make iron available to make red blood cells. So again, if you don't have vitamin C, you have problems with anemia. It also inhibits histamine. It improves cholesterol, not radically, but a little bit, 5%. And it lowers blood sugar. Again, not radically, but a little bit. The highest organ concentration is in the eyes. It's in the surface of the eye, where it helps to protect from infections in the outer surface of the eye. It's also present in the adrenals, pituitary glands, glial cells of the brain. And it's required in the blood to keep the liver healthy. The liver doesn't store it, but the liver chemistry involves vitamin C, and it kind of expects it to be in the blood passing through to work properly. It's also present in stem cells. The highest cellular concentration is in white blood cells. All right, that's where it's really packed into the cell, is in white blood cells. So, a few words about how your immune system works. All right. And I say that hygiene is overrated because our bodies know how to take care of stuff, right? We probably overly clean more than we need to be. Our bodies, internally, our bodies always contain small quantities of all kinds of things that we shouldn't be there, including abnormal cells like cancer cells, which are being produced all the time, and your body just takes care of them normally. And they're being eaten by phagocytes, which are the particular kind of white cell that envelops the pathogen and dissolves it, eats it. We only get visibly sick when either the white cells can't recognize the villains, or or can't ingest them fast enough for whatever reason. I mean, this is why you get sick from infections. If the body discovers an unrecognized invader, then you get antibodies are created after a few days, and this allows killer white cells to identify the bad guys and break the membranes, and then the phages can come in and eat them. And the reason this paragraph is here because this antibody response involves interferon chemicals, and vitamin C supports those as well. So when a phagocyte in white cell ingests an intruder, it has to deal with breakdown products. And it's mainly the vitamin C, which is a powerful antioxidant, that allows it to do this digestion. And if the white cells don't have enough vitamin C, or if there's not enough vitamin C in the body, the white cells won't have a high enough concentration to continually eat things, or there'll be less white cells. And the concentration of vitamin C within a white cell is about 15 to 20 times the amount that you find in a normal cell. Vitamin C exists in all our cells, but it's very concentrated in white cells because they need this protection, because they're going to have to ingest these foreign bodies. And so this is really the primary way that when you take vitamin C, how it suddenly supercharges your immune system, because what it's really doing is it's just allowing the white cells to operate in the way that several million years of evolution have designed them to, but that they can't in our bodies because we don't have enough vitamin C present normally. So when someone's died of a known infectious disease, there's no vitamin C to be found in the body. You can assay all the organs and you'll find no vitamin C there, which implies, they died because of lack of vitamin C, which was preventing the immune system from doing its job. Okay, so this is a long, complicated slide, and I put this together, so there's a lot of my interpretation here, but what I did is I looked at all the things which are documented where vitamin C, it works, and I divided them into their mechanism of action. So these are all lists of basically viral and pathogenic conditions where the immune system, when it's made to work properly, will deal with the disease. Polio, viral hepatitis, viral pneumonia, herpes, chickenpox, measles. The polio, the underlying ones I want to mention. Polio I talked about. Measles, when forgotten the guy's name. The original guy who was working on vitamin C. One of his children had measles, and he did an experiment where he gave them vitamin C. The measles went into remission, and then he stopped, and the measles came back. And he did this repeatedly about 3 times, just letting the measles come back and then knocking it back and letting it come back and knocking it back with vitamin C. And then eventually he gave them vitamin C for a week or 10 days or something, and the measles went away completely. So these are, okay. Vitamin C also operates as a biochemical cofactor, which means when there's reactions happening in your body, the vitamin C needs to be present to make the reaction happen, as opposed to being consumed and used to build tissue. So these biochemical cofactors are involved where there's not enough vitamin C, it will make these conditions worse. Diabetes, atherosclerosis, ruptured discs, corneal ulcers, right, et cetera, et cetera. The hypothyroidism is a little bit not quite a biochemical cofactor, because that works because hypothyroidism is when your thyroid hormones don't work properly. And there are 2 reasons for that. You might not have enough thyroid hormones in your body, or the thyroid hormones may not be able to get into the cell, across the cell membrane, where they act on the mitochondria. And vitamin C is required to get that hormone across the cell membrane. So sometimes hypothyroidism is caused by a lack of vitamin C. And again, this is clinically, people have done work on this. It's an antioxidant, and so it can, it addresses a lot of kind of toxic situations. Shock itself, can be mitigated by vitamin C intravenously. Bites, toxins from bites, et cetera, et cetera. I'm not going to read the list. And finally, apoptosis, cell suicide. It has a role to play in cancer, treating cancer, but you need very, very high doses of vitamin C, definitely intravenous. And I'll talk more about that later. So how much is enough? If you have 154 pounds of a typical mammal such as a rat, and 54 pounds of rats, they will make about 2 to 4 grams of vitamin C a day in their liver. This is kind of the normal production rate for a mammal. And if they get sick, they make up to 15 grams because the body needs more, the white cells need more. So these are nature's rates. If you go to a zookeeper and ask him how much monkeys need, the RDA for a monkey is in this range, the same 2 to 4 grams per body weight. But our human RDA, according to the government, is 24 times smaller than this 2-gram figure, right? So, what the government's recommending to us doesn't make scientific sense, is the point here. There are all kinds of political reasons for it being the way it is, but it doesn't make scientific sense. The sources, these are some figures for fruit sources. So if you want 1 gram per day of vitamin C, not the 2 to 4 that we're talking about, but 1 gram, you have to eat 14 oranges, 20 small oranges, 33 lemons, 50 limes, etc., right? So I don't think anyone's going to do that. So supplementation is the only way you're going to get the vitamin C in quantity. There's no dosage which creates dangerous side effects. There is no toxicity known for vitamin C. If you take a little bit too much, you get smelly loose stool. If you take far too much, you get clear liquid diarrhea, pulls water into the gut. If an ample intake, if you want to be very scientific about it, will spill a little through the kidneys, and there are urine test sticks that you can buy online to test your urine for that happening to get the right dose. It's both used and eliminated by the body, right? So as the body's using it, it's also the kidneys are pulling it out. And the way to take it is not to take a big dose once in the morning. It's to take a little bit all the time through the day. Once with each meal or something, but spread it out. The more you spread it out, the more effective it will be. There are some caveats. Vitamin C decreases the effectiveness of many anesthetics. The reducing action will break down the anesthetics, and so they don't last as long. When you go to the dentist, he's going to have to give you a refresher jab, towards the end because your body kind of broke it down faster than normal. And with chemotherapy, it's good and bad because if you take vitamin C in substantial quantities with chemotherapy, you can avoid all the side effects. Your hair won't fall out. You won't get all those bad feelings, right? However, for some chemo agents, it will break down the chemo agent, so the chemo agent doesn't work properly, right? So that's not something you want to do without discussing it with your oncologist. But that's a caveat here. These are a list of references, and this will link you to this presentation, plus a more extensive presentation that's in the same location on not only vitamin C, but also magnesium, niacin, which is vitamin B3, and iodine, as well as this, if anyone's interested. So, and like you say, questions maybe. Were the questions after the break or now?
You take questions now.
Okay. Yeah.
Sometimes it irritates my stomach when I take it.
Like stomach ache? Oh, yeah, well, maybe you have an acid problem because it is acidic, right? So if you have a problem with your stomach acid or, so that's got anything acidic would irritate that. But it's, if you still want to take it and you have that issue, I would dilute it a lot. Just dilute it a lot and take your 2 grams, with water throughout the day, yeah.
To kind of go off of her question, say someone does have a condition like diverticulitis, would vitamin C supplement possibly be better for that person?
I have no idea. My suspicion is that diverticulitis, once it's happened, is very difficult to reverse because it's actually, you've kind of got the pocket there, and there's nothing really causing the pocket to go away once it's formed. So You know, I have diverticulitis. I don't worry about it.
How much did you say a monkey needs to consume in terms of fruit to meet its requirements?
Monkeys eating fruit, did you say?
Yeah. How much did they need?
They need, per their body weight, it's the same as us having 2 to 4 grams. You know, you scale it down for the body weight.
Yeah.
Yeah.
What is that in terms of?
In terms of fruit?
Yeah.
I have no idea.
Because,
I mean,
you know, in the course of evolution, they lost
Yeah.
the ability to produce vitamin C, and that was because it was abundant in the environment and they were meeting their needs. They didn't
Yeah.
need to make it.
My argument isn't that monkeys are operating optimally. I mean, monkeys may also be not getting enough vitamin C.
Well, it used to be that fruit was available year-round. When there was climatic change, then there were winter months without fruit, and so there were periods where they couldn't get enough vitamin C, and it's interesting that you said you don't see symptoms until like 9 months out. So that got them through the winter months and back to where fruit became abundant and they could replenish their stocks.
Yeah, I'm not sure what your point is.
Well, it's that, you know, I do think they're getting adequate vitamin C levels. They might have been stressed at one point during the winter months, but it was not to an extent that required them to produce vitamin C. They could ride that period out.
Oh, you're explaining why they lost the gene.
Yeah.
Okay, yeah, correct, yes. I mean, we don't have the gene, and we live to be 80, 90 years old, right? I mean, it's not like critical to life. What I'm suggesting is that it's critical to perfect health, that it helps it helps in so many ways. It helps. It's not required, but it helps. You know, it's the thing that will stop you getting sick in the first place and stop you having to go to the doctor if you take sufficient amount of it. Yeah.
So what kind of supplementation do you recommend?
Are you talking about supplements generally?
No, for C.
For C, I take about 2.5 grams a day. Oh, I see. Oh, actually, I buy the powder. I buy the raw ascorbic acid powder. You know, simple crystal, pure vitamin C. It's available, you know, online. It's like a food ingredient. It's actually a food preservative. They put it as a preservative in many foods that you buy at the supermarket. It keeps forever. You know, the last I bought was some years ago because I bought 4 kilos, and I've used more than half of it. It works better if you do that. You don't have to, you know. I put mine in a glass of water and I drink it during the day. Sip here, sip there, you know. You can take, I would say, 1.5 grams. If you take it with a meal, you could take 1.5 grams without any stomach effects. If you take, you know, 2.5 grams, slug it down all at the same time, then you might start to get loose stool. But if you just spread it out a little bit, you won't have any problem. Any more? Okay. Yeah, Paige.
I'm being sort of facetious, but I saw on your slide a typical 154-pound mammal such as a rat. Have you seen a 154-pound rat?
I believe the slide said 154 pounds of rats.
I'm with you, Paige. I don't want to see 100.
Okay. All right. Okay.
All righty, thank you, Bob. So we're going to take a quick, let's say, 7-minute break. So go grab some coffee, go to the restroom, and we'll see you back shortly. piece before Will comes up. So here is our musician again. Jimmy is going to play us another beautiful tune, and I'm going to see if I can find a box of cigarettes to hold. Thank you very much. It just feels like there's more than one instrument in here when you're playing. All right. So one of life's burning questions. You do something to yourself, you know, like over the Labor Day weekend. I don't know, you get a really bad cut. Like, you know, it's not something you can just go into your bathroom and like get the Neosporin out and a Band-Aid. It's like deeper than that. But you don't want to, like, you're not sure where you should go next. Maybe it's not. Maybe the little Doc in the Box at the Walgreens is the place. Maybe not. There's the emergency care guy right in the next shopping center. There's also an urgent care place on a major road. Like, where are you supposed to go? Will Jeudy has the answer. Come on up.
That's a really good introduction. All right. See, I'll speak, I don't know, 10, 12 minutes, and then this subject kind of lends itself to some Q&A, like a rapid fire thing, because there's a big gray area, which I will get into. But for those of you that don't know, my name is Will Jeudy, and I am an MD. I graduated from residency in the year 2000, trained in family medicine, and so I was a family doc from 2000 until 2014. And toward the end of that time, I did some ER shifts, kind of out in BFE for extra money. But then started doing some urgent care shifts, again, just kind of moonlighting and for extra dough. But I figured out, I was invited to join the urgent care, and I kind of did some math, and I was like, yeah, I could just do urgent care and not have to do ER shifts. And I liked urgent care after doing a few shifts. So I started doing urgent care full-time in 2014, and that's what I have been doing ever since. So I have kind of some experience in all of these things. And urgent care lives in the area between primary care, your primary doctor or provider, and ER. So urgent care lives in the middle, and I'll kind of unpack that a little bit. So yeah, urgent care and ER are not the same. When I'm introduced to people or on shows or whatever, they'll introduce me as an ER doc. Oh, I heard you're an ER doc. And I always cringe a little inside, only because I know the difference. And for regular people, not a huge difference, but the difference is mainly in the training. So an ER doc, there's a specialty for ER physicians. And they do a little extra training in basically dealing with life or death situations, life-threatening situations. They're the last stop, and they treat these things. Whereas urgent care, there's no specialty for an urgent care provider. It can be a family medicine doctor like me, or a surgeon, or pretty much anyone with an MD. We just have to be able to recognize what is life-threatening and stabilize and get them to an ER. So a little bit of a difference. So, but there is a difference. If you introduce me as an ER doc and you realize, oh, I'm sorry, it's not a big deal here out in the real world. But just want to let you know that there is a difference. So there are kind of like three main differences besides the training of the people that you see. But the first one is level of care, and that's just kind of lingo in my world. Level of care just means what is needed for this situation. So a life-threatening situation, that's the highest level of care, and you'll hear me say that again. And there's a lot of gray zone in between, then there's like really easy stuff down here. So level of care is different between an ER and urgent care. The cost is also a big difference between the two. The cost to you all, and actually to insurance companies. So if an ER is on Yelp, it'll have like $3 or $4 signs. If an urgent care is on Yelp, it'll have one or two. So it's a big difference. The difference between 4 figures that you'll see on the bill or 3. Big difference. And insurance companies get the same bill. And ERs have to charge this because they have to have a lab that's available. They have to have CAT scans and MRIs and the level of training to pay the providers that have a higher level of training. They get paid a little bit more, so there's a reason for it. And then lastly, I put this on the list just because it's a thing in the real world, is hours. The hours that they are open. ERs are always open, and urgent cares tend to close about 9 or 10 p.m., probably about 9 p.m. So if something happens, even though, something happens at 1, and it's probably can go to the urgent care, but you have to have it taken care of then, the ER is the only option. So those are the 3 differences: level of care, the cost, and then the hours of operation. Before I forget, I almost forgot to put this on the list. If you see something on, like in a strip mall or a freestanding building, how do you know if it's an urgent care versus ER? Sometimes it'll be obvious. It'll just say emergency room, and that's a no-brainer. But if it says ER on the signage, it's going to bill as an ER, even though it looks like an urgent care. It's packaged as an urgent care. If it says ER or the word emergency on the signage, it's going to bill as an emergency room. If it just says urgent care, then it's again, they're making it obvious. But that ER thing, it's a little bit of a trick, so I just want to let you all know. So urgent cares are there to unload the ER. I love the concept of it. I have it written down here. So the thing about urgent cares that it's a plus is the wait times. It's going to have, you are going to have a lot less wait time in an urgent care versus an ER. Sure, our urgent cares can get busy, and you might be waiting 45 minutes, 2 hours if it's really busy, cough and cold flu season. But in the ER, most, if not all of you, had this experience, is you're there for just multiple hours, no matter what you come in for, and it's because of their triage system. You're on a list, but a heart attack comes in, or a bad accident comes in, and people are constantly being bumped down. Urgent care doesn't have that problem, so wait times are going to be a lot better for y'all. Again, urgent cares are there to unload the ER, and as more people use their urgent care, the insurances are billed less as a result. So they like that. It's more efficient for the insurance companies. Again, another reason why urgent cares were made and are thriving now. And I kind of think if you unload those ERs, there's less people crammed into the ERs, more people are going to urgent cares. The people that do need the emergency care get better results because they get better care. So that's just the humanist in me talking. And urgent cares are often an extension of your primary care provider. If you get a UTI or an injury after hours or on a holiday, then a lot of primary care providers know to send people to the urgent care. Yeah, I can't see you, or I'm booked all day. I'm booked until for 2 weeks. So go to the urgent care. They'll take care of you for this thing. So we're kind of an extension of your primary care doctor or provider. So, yeah, it doesn't even have to be a holiday. It could be just a regular day. You have an injury, you have an illness, you have a condition. What, do I go to the urgent care? Do I go to an ER? Sometimes it's easy. If you just kind of roll your ankle, you have a kind of the beginnings of a UTI. You know it's coming. You've had it before, but you can't get into your regular doctor. That's what an urgent care is for. It's kind of the easy stuff. It's kind of a no-brainer. If you fall down and there's a bone sticking out of your arm, that's another easy call. Yeah, you go right to the ER. If you have crushing chest pain, your face is drooping, you think you're having a stroke or heart attack, go right to the ER. Don't even think about the urgent care, because urgent cares are there to unload the ER, but the ERs are there for a reason. They take care of the life-threatening things. So again, if it's obvious like that, go right to the ER. But again, there's a big middle zone, and this kind of Q&A may have some of these scenarios. There's a bunch of them. For me, the gray zone is kind of this wide, because I kind of know what to do about certain things. Regular people that don't have my training, and maybe the gray zone is a lot bigger, so I totally get it. So gray zone things would be abdominal pain. Urgent cares, we don't have a lab. And we do have a lab, but it takes about 2 days for the results to come back. We have to send it out, come back. So if I'm really worried about somebody. I'm not going to say, okay, let's take some blood, and I'll call you in 2 days if something's wrong or whatever. No, in those 2 days, they could die of kidney failure or something. So we do not use a lab to try to tease out, is this life-threatening or not, because we don't want that 2-day delay. Imaging is another big thing, a big difference between urgent care and ERs. In the urgent care, we have X-ray, and that's it. So ERs will have ultrasound, they'll have CAT scans, MRIs. So abdominal pain, that's kind of a gray thing. If it's just you ate something bad, you have some diarrhea, nausea, we can take care of it. But if it's like pain, you're kind of doubled over, you should probably think about going to the emergency room. And now, if you get a bad stomach bug, yeah, you can get the twisty, crampy pains. It feels bad, but it ends up getting better. I would kind of nudge you more toward the ER in that situation, because a CAT scan or ultrasound could be life-saving. But yeah, that gray zone is kind of, a lot of the stuff we see in the urgent care is just routine things. It's pretty easy, hum-ho, a good variety of stuff, actually. I like the variety. But then you come across something, the gray, every shift there's at least 1 or 2 things that are like, oh, does this person need to go to the ER, or can I treat them? It's always a little bit of risk involved, because if I think, shoot, this might be this, probably this, but it might be appendicitis. So I'll really do a good job of, okay, I'm going to treat you for these things, and I'll educate the patient on, if this happens, if this happens, if this happens, then you need to go right to the ER. So that's a little bit of a risk sometimes. But if I'm really worried about appendicitis, I say, yep, you're going to go from here to the ER. So yeah, we deal with that. We deal with that a lot. So. Word of advice as I close is look up what the nearest urgent cares are, and actually ER, to where you live or work. Because when the time comes, sometimes you cut yourself, or you fall down. You don't want to be looking up what's the nearest urgent care is with all this blood coming out off your hands, or you're in a hurry, you're just not in the right mindset. Look it up ahead of time, write it down, or put it on your phone. That way you have it available if and when you need it. That's all I had to say about the difference, and I kind of open it up to questions. Again, there's all kinds of scenarios, and I'm sure you all have had your experiences with urgent care versus ER. But in a nutshell, that is the difference between the two.
Hi, my question is about medical insurance. I'm assuming urgent cares do not accept people without medical insurance, without health insurance? And ERs do. They're required to, aren't they?
Yes, urgent cares actually do accept people without insurance. So they're each going to have their own scale. The urgent care I work in, there's a scale. So easy stuff is this much. I think it's like $200. Middle, and then there's 3 tiers. So 200, 250, 280, something like that, roughly. But yeah, we accept it. It's just that it's going to be a different payment. And you're right, ERs have to accept everybody. You're right.
So great talk and great topic, Will. Thank you. Richard Andrews here. I'm also a family doctor. And it can be confusing for people, at least in our healthcare system, which is kind of bizarre in terms of the financing or lack of financing. And so over the course of many years, people would often get these horrendous emergency room bills because, as Will suggested, it wasn't clear to the patient, and sometimes they deliberately make it fuzzy, whether the place you're going to is an emergency room or an urgent care place. And so they often deliberately make it look like an urgent care place, including, historically, ERs were always attached to a hospital. Well, then they realized there was a lot of money to be made by having freestanding emergency rooms, sometimes financed by venture capital and that sort of thing, where they're flat out there to make money. And yes, you can get your emergency address there, and you should go there if you have an emergency. But people are fuzzy on, if a person has chest pain, there's a good chance that it is just gas, or it could be a heart attack, and patients don't know which one it is. And so they're constantly asking themselves, is this an emergency? Do I need to go to an ER? And that eventually got more or less resolved in the courts, because these things always end up in court, of course. And so an individual patient, as long as that individual person believes it's an emergency, they're not held to a legal standard where they know for sure it's an emergency and therefore insurance will cover it. You can go to an ER, and if you think it's an emergency, then it should be covered. Now, everything ends up in court, like I said, so, but that may be helpful to know that.
So I have a couple of quick questions. The first one is about the little clinics that you see in like the HEB or the CVS, kind of what role do they play in, like, they provide some care also? And the next one is that I've also heard that if a urgent care or something is affiliated with a hospital, that sometimes you can be charged basically hospital rates because the hospital considers that clinic an outpatient of their facility. So any knowledge about that?
Yeah, I don't have a ton of experience with either. I think those minute clinics and CVS stuff, you should consider them urgent care, put them in that same bucket. The urgent cares, because yeah, hospitals, the Methodists and the Memorial Hermans of the world do have their own urgent cares as well. I don't know if their billing is a little bit higher because they can get away with it. I really don't know that. I'm going to guess that it's still in that urgent care bucket, but is it like a little bit more? That I don't know, but I'm gonna guess that. Yeah, there should be pushback on that because it shouldn't get a little extra just because they have Memorial Herman on the name. Yeah.
Since you gave a version of this talk several years ago.
I did. Yeah.
Yeah, but I mean, that was a long time ago relative to the changes, I believe, that have taken place. I mean, I also moved. So I moved into a part of town, there are even more of these dock-in-the-boxes, you know, generically. The one I chose when I had COVID symptoms, and my family urged me to go find a place where I might be able to get a prescription for the, whatever it's called with an X in it. I can't remember the name of it, whatever the, I had excellent experience, and when I looked up the name of the place, which is so short distance from my house, it says ER.
Right.
And if I had realized it was an ER, per your definition, I might not have wanted to go there.
You shouldn't have gone there.
But
you didn't know. Yeah.
But my family actually forgot that. They looked it up for me and found out that they would take insurance, which is Medicare plus supplement.
Right.
I got wonderful treatment.
Okay, good.
And fast. Just saying. There's
Yeah,
lots of choices.
as Richard said, and as I said, they make it a little bit fuzzy and tricky sometimes with the packaging. So look it up ahead of time, have an ER on your list, and have an urgent care, or maybe 2 urgent cares. That way you already know ahead of time. And you can always call them, hey, do you bill as an ER or an urgent care? And they'll have to tell you, and that'll tease it out.
Well, about a decade ago, I went through a decade where I went frequently to the ER at Herman Hospital, and I got excellent, long, expensive care, and usually wound up in the hospital itself having surgery. And thankfully that's passed. Well, recently I had an occasion to go to their new urgent care near me, and I assumed from you having spoken to us and everything that there would be a doctor there. And I had a festering infected elbow, and so it was oozing blood and pus, and I thought I needed something. So I went there, and they put me in a room and sent me to a room where I would be seen, and someone came in and I was seen. But the someone never introduced themselves or expressed what their title was or anything like they do in emergency room, or at least they did in my emergency room. I'm your doctor, or I'm your nurse or something. And on this festering, oozing wound, put a plain piece of gauze and wrapped that nice rubber stuff that the blood draw people put around. And I expressed concern that that would not last. And she said, oh, yeah, this is fine. So, of course, a few hours later, the rubber stuff was down on my wrist, and the gauze was still in place, sort of glued by pus and blood. And so, thank God I had some gauze that didn't stick and some better tape and put it on. And I felt so strongly about it that I took a proper bandage by the urgent care place the next day and said they should give it to that woman and show her what to put on an infected wound. But could that possibly have been a doctor who did that? Because she never identified herself at all.
So, yeah, it's a good comment, or good, I can unpack that just a bit. I work for a specific urgent care, and they do a good job with hiring providers. Now, there's some doctors, there's some physician assistants, PAs, and the nurse practitioners. Everyone should introduce themselves as what they are. It's just kind of courtesy, and it makes sense. Now, I don't know that person, if they were an NP, nurse practitioner, PA, or MD, I don't know. But the urgent care that I work in, they do a really good job of hiring people, and I would put faith in anyone you would see in the urgent care I work at. I'm not going to mention it, but anyway, after. Yeah. So I would have confidence. Like I review charts. I'm an MD, so I review some of the PA charts and nurse practitioner charts. I mean, there are a few, 3 or 4 that are as good, if not better, than I am. They are wonderful. So I had confidence in the people that work for my urgent care. You're right. You're gonna have some scrubs, and you're gonna have some not so good people. And kind of that's anywhere you go. But just because they're a nurse practitioner or PA doesn't mean you're getting less care. So that's kind of where I land on that. Sorry that happened to you. Yeah, it's yeah, that kind of sucks. The what? Right, and they're the competence, right.
Okay. So about 2 decades ago, so this is a long time ago, my daughter, who was about 2, was in a car accident, and an ambulance took her to the hospital, and the paramedics were great. She got the emergency room, the doctors were great, everything was great. And the bills came in, I don't know, a few weeks later, a month later, and the doctor's bills, emergency room, was what I expected, for an emergency room. But I got sticker shock when I saw all the things come in for the ambulance. Why was it so expensive for an ambulance to go 2 miles? Do you know anything about that, or?
I don't know much about ambulances. They're their own private companies, kind of for-profit. I never liked the for-profit presence in medicine. Even on day one, like insurance companies, I did not like it. And as I did more and more medicine, I liked it even less. So that's it's probably be just the ambulance company doing it. So yeah, sorry about that. I don't think there's anything to do about it. Now, ambulances save lives. In general, they serve a purpose that absolutely saves lives. But in the situations where, right, it maybe wasn't needed or didn't save a life per se, they're still going to do what they do to, So there's a risk. We think about this a lot. Even with somebody is in the urgent care, let's just say they're having some chest pain, and it's not an obvious heart attack, but I'm worried about it. Now, I always struggle with this. Do I let them drive themselves, or do I call an ambulance? Because if they have a heart attack en route, it's on me. Like, and I don't want that scenario. So I always have to figure that out.
How much standardization is in the the urgent care on the equipment they carry? Because it seems to me like that will be a big, if you're looking for a diagnosis of whether what you got serious or not, whether they have the equipment available, whether it's labs or scanners or whatever, to do the diagnosis is kind of like a big deal.
Yep. So I'm confident any urgent care you go to, the labs or the X-rays that they have are going to meet a minimum standard, and that minimum standard is actually pretty good. So I would have faith in the equipment doing their job. The interpretation of the equipment, the human part, the physical exam, That's the part that's the art of medicine. But the equipment that we use is all, yes, I would have total faith in that, the EKG machines, all that stuff, yes.
Time for just one last one.
Hey there, I've got kind of a broad question. So sort of piggybacking off of the ambulance question, which I know you said you didn't know like a ton about those, but also the solo emergency rooms that people said, hey, we can make more money from these. How much with like those emergency rooms and ambulances do you feel like like they have such surprising price tags because they're kind of being exploitative, or because that's a justified cost most of the time? What's your like sense of that?
It's a great question. Because they are for-profit entities. So in this society, they're allowed to do that. Now, they do take a hit with people that they have to treat that they never get any payment from. And they still have to pay for these machines and the providers and electricity and all that stuff. So that's part of it. They do pass that price on to insurance companies and patients. But they're also a for-profit entity. So I think that the two of those things amount to that sticker shock. Yeah. Y'all have been great. Thanks so much.
All righty, that was a lot of information. Thank you, Will. So let's see. I'm going to have a few announcements here. Oasis is putting together a cookbook. So if you have any family recipes that you would like to contribute, just contact us through the website. You can do board at Houston Oasis, or if you want to find Verena, she will be glad to take your recipe. And we're going to send that out at some point as a part of a fundraiser. Book club will be meeting soon. There's some list of events in your program here. So we have book club coming up. They have a new book, The Only Woman in the Room, about Hedy Lamarr. So that looks very interesting. Oasis Cards is still meeting on Saturday nights. You can talk to Richard about that. Andrew's back there. He can, if you get on his email list, he'll get you hooked up to be able to do that. We also, I think we have some bar nights coming up. That's not on this. Yeah, on the list. So check social media. They should be on Meetup and Facebook and Instagram, things like that. So we have lots of stuff going on. Uh-huh. Oh, okay. Okay, so if you didn't hear that, Tish is doing a community moment, and she needs photos of pets. So if you have a pet photo that you want to share. My email is tishperez@gmail.com. Like one photo, or can we send like 20? Okay. So maybe not 20, but you can do more than one. So we would not be able to do what we do at Oasis with a whole bunch of volunteers. We have the folks that do our sound, who arrive early every Sunday, schlep the stuff from the storage room, set it up, make sure the mics are working, all that stuff. We have people who come early and set up chairs, because the room doesn't just come like this. We walk in and it's all like empty and the chairs are over there. So people are setting that up. We have folks that are doing the coffee. They also bring this coffee stuff from the storage room. Have to get here an hour ahead of time because it takes about 45 minutes for that whole big thing of coffee to percolate. So yeah, it takes a lot of work to get our meetings going every Sunday. So let's all give a big hand to all the folks who. We also couldn't do this without money. We have to pay for storage. We have to pay for rent. We pay our child care workers. We pay for musicians. So we really do depend on financial funds as well as volunteer hours and blood, sweat, and tears. So if you are able, we would really appreciate a donation. If you're able to make a recurring donation, that helps us even more. It helps us with budgeting and knowing how much we're going to be having coming in so that we can plan. So I would encourage you to see our table at the back. There's a hat where you can drop in cash, money, or checks. And I think Tim would also be happy to take a credit card from you. There's also, if you want to sign up for recurring donations, he can arrange for that. So that is my money pitch. Done with that. So now, anybody have anything that they are excited to celebrate or tell us about, or if you have any concerns? Okay.
Check y'all's voter registration, because there's some really weird stuff afoot in Texas. Harris County, harrisvotes.org or Go Vote Texas or something. Anyway, check your voter registration, even though everything's been great, because, yeah, there's some weird stuff happening in Texas. And deadline to get it all fixed is October 7th. Thank you.
Yes. That was a good reminder. All righty, so I think that's about it. Jimmy is going to play us out here, so thank you all for coming, and let's hear from Jimmy. You can always tell the ones that make their living doing this, can't you? Thank you very much. That was great. All righty. Well, that is it for today. Y'all go out and have a great week. Go in peace. Oh, and if you want to contribute today, you can help set up, put the chairs back. Oh, lunch is at Harry's Restaurant. And, oh, one quick thing. So this restaurant, if you have a table with more than 5 people at it, they only want to do 1 check. So just be aware when you're going. If you have a super big table, they're going to want to do 1 check.